This is Dr. Elizabeth Naylor, and I'm here with Joyce Gaines, who has agreed to talk to us a little bit today about her experience working with holistic nutrition in combination with her other medical care over the last few years. And so, thank you, Joyce, for joining us.
It's my pleasure.
So, why don't you begin by just talking about how you decided to start doing a nutrition protocol for some of the health issues that you're dealing with?
Certainly. I have a long history of allergies, and in fact, I had the same allergist for 28 years, and he did not nail what was happening to me. And because the allergies were uncontrolled, I ended up with back to back pneumonia 2 years in a row. And that left me with a fairly rare lung condition. I have irreparable damage to basically my breathing tubes. And then another opportunistic lung, you know, disease came along. And so now I have really a plethora of lung issues. And finally decided that if the medical community wasn't able to help me, I needed to get creative. And I found you, and hallelujah. I'm so glad that I'm trying a combination of both your guidance and the things that the medical community can give me that I really must take. Things like my inhalers.
Yeah, so I know you went through a kind of a long journey to get to that point where you felt
Yep.
like, okay, I've got myself on an equilibrium and a balance, and um, we're now in January of 2016. But if I recall, 2015, the winter was a bit better than 2014, and
Oh, it's 2013 and 14 were bad. I mean, I those are the years I had my back-to-back issues. And what is so neat now is I have you put me on a path of prevention, and so I'm taking, echinacea every day, twice a day, 365 days a year. So it doesn't matter, if it's just, cold weather or hot weather. When you have compromised lungs, that can be problematic anytime. Um, so I'm really happy that I have now a preventive program in place, and I think the kinds of things that I'm taking are helping me to perhaps limit some of the damage caused by prescriptions, steroids, and things like that. I just hate taking them, and I only take the ones that I absolutely have to take. So, in addition to the prevention and the proactivity, I really enjoy knowing that there is there's a plan B and a plan A, and my plan A are my maintenance products. That's what I'm on all day, every day. And I've begun now, after a period of knowing what to watch and knowing the signs and the symptoms, I can monitor how I'm feeling, what's happening. If I get super fatigued to the point where, I can barely drag out of bed, okay, it's time for my Plan B regimen. And those are stronger drugs that are going to fortify my immune system and keep me from getting another infection. So it's been a journey, and a lot of it is self-awareness combined with the Plan A and the Plan B regimens that augment what I'm doing from my doctor and my pulmonologist. God bless him. He embraces holistic medicine, so it's a combination of East and West with trying to find the things that are going to do the most good and the least harm.
well, and I know you've been a lot of fun to work with because you're very aware of what's going on with your body, and you're very aware of when you need to move to Plan B. And I
Yeah.
would say there's also a Plan C, because I think Plan B is mostly herbs and additional, like higher intensity interventions that are still not necessarily prescription. And then you move to Plan C when you know you need to move to Plan C,
Yes.
which moves on to the medical side.
And that's an antibiotic, and I haven't had to have an antibiotic in over 2 years.
Wow.
And that is a huge step because it just destroys your immune system. And had I kept on year after year taking the antibiotics, um, I am sure that my health would be compromised.
So I know you also have done a lot of research on your own, and and that's been really fun for
Yeah,
me and helpful. And I know we've found some things. It's fun to work back and forth with
yeah,
you with when I tell you, well, this is what's in this herb and why this works. That's kind of empowered you to then go out and say, okay, well, I think this might work too,
yeah.
and so you've put together your own proactive
Yeah.
protocol.
Yeah, you would think if you get to this juncture in life, you would know what a thymus is and what it does, but I'm sorry to say I didn't, and now I do, and I understand why it was compromised with age and the kinds of things that you did. And then with that, yes, I did some of my own research, and I found one thing that helps to loosen up the congestion in my chest. And so it's a combination of what you've guided me to, what I have found on my own, because I am very there's nobody that's going to take care of me but me, and I am very eager to have quality of life. I have longevity in my family. My mom lived to 92, so if I'm going to have a great aunt that lived to be 104.
Wow.
So if I'm going to do it, I'm going to do it with the most quality that I can come up with.
Right. Well, and Joyce, you bring a unique perspective as well because you are in the world of healthcare
Yes.
and working with health insurance plans and working with individuals and companies, mostly companies who are dealing
Right.
with their employees and individuals. So I know a lot of times one of the pushbacks that nutritionists get are that insurance doesn't pay for it. So can you give us a little bit of a perspective on your thought process and how
Sure.
you've incorporated prevention that's not paid for with your medical plan that does pay for things?
Yeah, I think that's a very myopic viewpoint. And before I became a benefit consultant, I was a speech pathologist and I work with stroke patients. So I've seen um, enough devastation, people in fetal positions, unable to speak, take care of themselves. So I became very active in healthcare and proactivity and prevention before it was even popular. But when I think about people saying, "Oh, I can't pay for these things," what would you rather do? Would you really rather let the condition worsen, end up having to have be hospitalized, meet your deductibles, the out of payments have gone, they've skyrocketed. And it's in the world of business, group insurance, the employers cannot pick up everything anymore. So they are going to be passing more and more of the expenses on. I'd rather go ahead and pay out of pocket while I'm still healthy rather than see a degradation of my health. And then you've got people that have to help you. If you're sick, then you've got family members that might have to take you, for a procedure. And it's just a ripple effect that's nasty. And it's in many cases preventable.
Yes. Well, and the sad fact is, the older we get, the slower we are to heal, and
Yes.
sometimes we don't heal because we just are simply. There is a factor of getting older that plays into the equation, so it's much better to stay away from being ill. So, well, thank you, Joyce, for your time. Is there anything else you'd like to say to those who might be contemplating adding nutrition to their
Yeah.
regimen?
I I wish I would have gone down this path years and years ago. Although I was going down the path somewhat, I haven't studied as Elizabeth has, and I didn't. I wasn't able to connect the dots, even though I was interested in connecting the dots. I couldn't. I just didn't have the background, and I think. I think if we aspire to have an incredible quality of life, we need to surround ourselves with a team. And that team can be comprised of your medical team and then someone like Elizabeth who has the know how to augment. And without a doubt, the passion, the dedication, and the total emphasis on quality of life, Elizabeth's got it. And so it's not that she would be trying to offer products that are going to, be in her best interest. It's not, that's not the approach that she exhibits. It's totally what is in the client's best interest. And I'm just really glad I've got her on my team now.
Well, thank you, Joyce. And I'm glad you're on my team as well because I love you, love working with
Love
you.
you too.
So, thank you so much for your time today.
You bet. Have a good night.